Today, the topic is mental health and substance abuse. And I think what we need to understand is that we're going to be covering mental disorders associated with substance abuse. And I trust that this workshop would be an informative workshop so we can act on an informed basis at the different levels that we are working in the respective fields in substance abuse treatment. Relating to early intervention, pre-treatment, treatment and referrals to the professionals and aftercare. So, yes, thank you. Yes, we're going to be focusing on dual diagnosis and just what is the meaning of dual diagnosis. It's a person with dual diagnosis has a mental disorder and an alcohol or drug problem. These conditions occur together frequently. About half of the people who have a mental disorder will also have a substance use disorder at some point in their lives and vice versa. The interactions of the two conditions can worsen both. So we're looking at an integrated treatment process, and I welcome you. I have many speakers on the program. So we will have engagement later on. As I said, continue with your questions in the chat, and these questions will be answered at a later point in time. Our first speaker to give us an overview and to assist us in understanding some of the concepts that are going to be utilized today would be Katlego Rafapa. He's busy completing his master's degree in clinical psychology, and over to Katlego.
My experience is in both counseling and clinical psychology. So this morning I would like to begin by just familiarizing ourselves with certain terms that might come up during our presentations. So it's going to come up on your screen now. I'm just going to begin with the term mental disorder. We hear this term used a lot, but I'm going to define it for you in a simple way so that when it's used in the presentation, we can have an understanding of what exactly it means. So basically, the word mental disorder is any breakdown in cognitive, emotional, or behavioral functioning. Now, what's important is that we all go through our own troubles. However, if that breakdown in cognitive, emotional, or behavioral functioning affects our daily living or our lives, then it's considered a mental disorder. Now, the manifestation of how it affects our daily living can be seen, for example, with a person experiencing relationship problems. Some people's academic and job performance starts to also suffer, and other important areas of their lives also start to suffer. So that basically is what we call a mental disorder. What's important is the fact that as much as it's a breakdown in cognitive, emotional, and behavioral functioning, it must affect the person's life. Secondly, we hear the term used a lot, especially in the clinical context, symptoms. Now, what are symptoms? So symptoms are any mental or physical sign that is suggestive or indicates that there's an underlying condition. So I'll give an example. So later on, I'll be discussing psychosis. One of the symptoms of psychosis is hallucinations, which is having some perceptions that don't have any external stimuli. But we'll discuss that in more detail later on. Now, a disease normally is a cluster or a collection of symptoms, right? Basically when we use the word symptom or symptoms, that's what we're referring to. Now, also, what I need to mention that's not up on the screen is the DSM. You will hear it being used multiple times, particularly when our psychiatrist, Dr. Markham, is going to start speaking. The DSM basically is the manual or the book that psychiatrists and psychologists use to diagnose mental disorders. I will explain it in more detail later on. The chapter that's relevant for today's chat is the chapter substance-related and addictive disorders. This chapter in the DSM has all the disorders that are associated with the abuse of drugs and other substances. and Dr. Steve, our medical doctor, will also get into more detail about the specific individual substances. And also, it is also important to understand what we mean by psychoactive substance. It is also important to know what we mean by psychoactive substances. So psychoactive substances are any chemical compounds that normally come in the form of any drug. Now, when I say drug, it means both illegal or illicit substances and also those ones that are legal, right? Any of those drugs that alter either the person's mood or behavior or both. So, for example, with illicit psychoactive substances, you have, for example, cannabis is an illicit psychoactive substance, meaning that it alters a person's mood and behavior. Some of the legal psychoactive substances, for example, if a person is diagnosed with major depressive disorder, antidepressants are prescribed. The main function of antidepressant is to alter that person's mood so that it improves. So it can also be considered a psychoactive substance. I think someone, can you please mute? I hear sound in the background. Okay, thank you. What is also important is to distinguish between what is substance use and substance abuse, right? A lot of people who drink, for example, during the weekend, or in some instances, some people use illegal or illicit substances, not regularly, just on occasion. That we can define as substance use. More specifically, the ingestion of any psychoactive substance. Remember, we stated that any psychoactive substance means that it alters either your mood or your behavior or both, right? So any ingestion of any psychoactive substance in moderate amount, right, that doesn't interfere with your functioning. By functioning, we mean that it won't interfere in your educational, social, or occupational activities. So a lot of people do use substances, but they don't abuse them to a degree where it interferes with their daily functioning. So yeah, so substance use is just using psychoactive substances, but in moderate amounts that doesn't negatively affect your life. Whereas with substance abuse is when psychoactive substances, whether illicit or legal, affect your life to a degree where it starts affecting your job, your relationships, and also your education. And in some instances, it puts the person in physical danger. So that's the difference between substance use, where most people do use substances. And so that's the difference between substance use, where people will use substances, but in moderate amounts, not to a degree where it affects their life. But substance abuse, the difference with that is that they use it to such a severe degree that it starts affecting their life. So that's the difference. Now, why do people use substances? It's not for the taste in most instances. It's because when they use their specific substance, it has some physiological reaction immediately when they ingest it. Colloquially or commonly, people refer to it as getting high or getting drunk. That's what we call substance intoxication. I know a lot of people, when they pronounce it, they say substance intoxication, but it's actually substance intoxication. Okay. So lastly, I just wanted to also speak about substance dependence, or what is commonly referred to as addiction. Now, it's characterized by three things or three symptoms. Number one, it's characterized by tolerance. Tolerance is when a person uses a substance for a prolonged period that it requires increasingly greater amounts of the drug to experience the same effect. So just to give an example, a person might start using cocaine, and then let's say, for example, in the beginning, they're only using 2 lines. Those 2 lines give them the substance intoxication that they're satisfied with. But as time goes on, they'll require more amounts of that same substance because the body starts developing tolerance for it. So that's one of the signs of substance dependence or addiction. That's why the disease of addiction or substance dependence is considered as a progressive disease, specifically because of the tolerance. because a person requires a greater amount until eventually it either impacts your life negatively, or in some sad instances, people actually pass away from ingesting too much. And the second symptom of substance dependence or addiction is also withdrawal. Now, this happens at any point where the person stops taking whatever drug they're using, and then it starts having some negative physical reaction. And it depends on the specific, the severity of the withdrawal symptoms depend on the specific substance. So, for example, we know that with opiates, for example, they have the most severe withdrawal symptoms. And Dr. Steve will just touch more on how they manage the detox stage where the person is going through withdrawal. And lastly, also, we have drug-seeking behavior. That's also one of the symptoms, where a person, for example, will continue using the substance despite its negative consequences in their life. And also, we all know this, they'll start stealing, whether from friends, whether from family members. And there is also an increased likelihood that even if the person stops using the illicit substance, which has been impacting their lives negatively, they might still, in most instances, go back to using, even after a prolonged period of sobriety. That's why one of the things that they talk about in substance dependence is that for some individuals with a substance use disorder, it is possible for them to stop using, but to stay stopped is the issue. So they do have those periods of sobriety. So yeah, just to summarize it, particularly with substance dependence, or what is commonly referred to as addiction, it's those three symptoms. Number one, the tolerance, requiring increased amounts or greater amounts of the same substances to get the same effect. Number two, whenever you stop the substance, you have a negative physical reaction, which is called withdrawal. And thirdly, the individual also engages in drug-seeking behavior, such as stealing from their family and also continuing with the drug despite the negative consequences. And lastly, there is unfortunately an increased likelihood of resuming using their preferred drug despite it having negative impact in their life, even after a long period of sobriety. Okay, thank you so much, guys. I will be back with you guys later on. So I just needed to define these terms so that when they come up in during the presentation, you guys are familiar.